Welcome to our video series, Living with Heart Failure. I'm Julie Chang, a pharmacist in the Heart Failure Care Management Program in the Department of Cardiology at Kaiser Permanente. This video is the third of a three-part series to help you learn about managing the condition of heart failure toward living a productive and satisfying life. Let's look at some daily activities that will help to manage your heart failure condition. The best time to check your blood pressure is 1 to 2 hours after you have taken your medications in the morning. The reason is that we want to check your blood pressure once your medicines take effect. We want to have blood pressure at less than 120 over 80. The systolic blood pressure, or the top number, can be in the 90s. This is not unusual as long as you feel well and do not feel dizzy or lightheaded. The goal heart rate is somewhere in the range of 55 to 75 beats per minute. It's okay if your pulse drops below 50 beats per minute, but we want you to let your doctor know. Call or email your doctor that day. Don't wait till the next day. We recommend that you start every day by weighing yourself. Do this at the same time every day. We want to be able to compare weight from day to day under the same conditions. For instance, you may want to weigh yourself each day before breakfast and after using the bathroom. If you have a weight gain of 2 or 3 pounds in a day or an increase of 5 pounds over 5 days, and you have not changed your eating habits, this could be a symptom of fluid retention, and you should tell your doctor or care manager. Other signs to watch for is a change in the quality of your breathing, feeling the need for more pillows under your head when you're trying to sleep, or perhaps feeling a need to sleep in a recliner. Waking up during the night with shortness of breath or gasping for air is not normal, and we want you to tell us if this happens. If you feel you have a difficulty breathing and it may be getting worse, or if you cannot catch your breath, call us right away. Manage your daily diet. A healthy diet will include whole grains, fruits, lots of vegetables, and less saturated fats or cholesterol. Our best nutrition will come from preparing fresh foods. We will have more control over the quality of our diet when we prepare our own meals and cook meals at home. Try as much as possible to avoid processed foods, canned foods, and foods that are preserved, like pickles and packaged meals. You may often hear to drink plenty of water, and we certainly want you to drink when you are thirsty. But with heart failure, we need to limit our fluid intake to no more than we need. Usually 8 cups or 64 ounces per day. This includes all liquids, not just water. Juices, soup, coffee, tea, ice cubes, and even ice cream. It is important to keep sodium levels low. Too much sodium or salt will worsen our condition. This may not be easy, but we want to make our best effort to do this. High sodium levels will encourage fluid retention, and that will be harder for your heart to function normally. Try to limit your sodium intake to no more than 2,000 milligrams or less per day. We have a separate video segment about nutrition and heart failure. We encourage you to watch it for more valuable nutrition and diet information. If you are a smoker, we ask that you try to stop. Quitting smoking is one of the very best things you can do for your health. Our health education department and wellness coaches are available to assist you to quit smoking. Drinking alcohol in excess can contribute to weakening the heart muscle. If you are drinking alcohol regularly, we ask that you cut back or stop if you can. Kaiser Permanente offers many resources that can be helpful. We all need to exercise. Staying active will help to manage the symptoms of heart failure. Exercise allows your heart to pump and work at a stronger pace. We want you to begin slowly as soon as you can after you leave the hospital. Be careful not to exercise too much. Discuss how much to exercise with your doctor and care manager. You don't have to run a marathon. You might start with a walk, or if you are having problems with your knees, you can do exercises in a chair. It is also important to do stretching exercises regularly. You might use some light weights or elastic exercise bands. Be careful and listen to your body. If it is telling you that you're tired or you're short of breath, then stop to catch your breath. If you feel you can keep going, then continue exercising. But if you feel like you're done for the day, you can try again later that day or begin again the next day. We don't want you to give up on exercise. Avoid exercising in extreme hot or cold weather. Indoors may be better when there are extreme circumstances outside. Remember, we said to go slow and pay attention to your body and your comfort level. Make sure that you balance your exercise with rest. Even after light exercise, we recommend that you rest. The benefits of activity and exercise will keep your joints flexible, manage your weight, increase your muscle strength, increase circulation, and improve blood flow. Travel during this time may be difficult, and you may want to wait until you have increased your stamina over several weeks. We need to be careful about the foods we eat and their sodium content. If you do travel, make sure you carry your medications with you and not in the luggage that gets separated from you. Arrange for refills before you leave so you know you will have enough medications to last during the trip. If possible, take a scale and a blood pressure monitor with you. Most hotel rooms do not have scales. If the hotel has a gym or activity center, they may have one there. Even while on vacation, we want you to keep track of your weight and blood pressure. Fluid weight could accumulate as you travel. All of these changes and cautions may have you feeling frustrated. Remember that feelings are natural and expressing them is healthy. Kaiser Permanente offers many services to help reduce stress, anxiety, and help you to sleep better. Stress and poor sleep can act negatively on your health, so we don't want to ignore that. We offer classes, one-to-one appointments, telephone counseling, and other resources online. You are already taking an active role in managing your healthcare by joining us today. Be patient with yourself. Becoming accustomed to these new daily routines can take some time. We try to do everything we can to make these changes as easy as possible. With well-managed heart failure, it does not need to dominate your entire life. You can move forward. Take advantage of work with your doctor, care manager, counselors, and ask for support from family and friends. We hope this information has been helpful. Please remember to follow up with your doctor or care manager. Thank you for watching the Living with Heart Failure videos.